What's up, you guys? Welcome back to my channel. If you're new here, thank you so much for tuning in to my new video. My name is Morgan. I'm a second year, I guess now a third year medical student in New York City, wrapping up my clinical rotations. And if you're already a subscriber, you know the deal. So let's jump right into it. Today, we are doing my pediatrics rotation recap. This is rotation 6 out of 7 for me for my core clerkship year. So things are flying by and I'm just so excited to debrief this rotation with you guys, tell you how I did on the shelf exam, and also give you some tips to crush your peds rotation. So the first thing that we always chat about is what my schedule was like. My pediatric rotation was 5 weeks long with my school's curriculum. So I started with a week of outpatient, which I thought was amazing. It just gave me the opportunity to kind of see a lot of more healthy kiddos and just get familiar with pediatrics in a less fast-paced environment and a less acute setting than the inpatient setting. So I was somewhere different every morning and afternoon because that week is not graded for us. So I was able to see endocrine, where we saw some obesity, some diabetes, gender affirming care, growth related delays in care, different things like that. And then I did the adolescent medicine clinic. I also did a private practice where they saw everyone from babies to adolescents. And I also did a little bit of time at Bellevue in our primary care clinic, which kind of just is a walk-in clinic. So anyone that comes in, we take care of them. And I got to give some vaccines, which was really scary, but a lot less terrifying than I thought it was going to be, because and I think the babies are much better than the older kids. Like, I did a 4-year-old and that one was really tough because they knew what was happening and they hated me after. But I also did a 4-month-old and that one was much better. Baby was crying for a little bit, but then after mom consoled them, and then it was totally good. So that was amazing. That gave me a solid foundation. Then I got to build on that when I went to the nursery for the next week. So that was really nice because our nursery schedules are 9 to 12 or 9 to 1. And I was working directly with an attending, essentially would head in, pre-round on my patients, present to the attending, and then we'd go together to see them. But I got very comfortable with a well baby exam and talking to new parents, which can be very terrifying because they're scared, versus some of the parents who have done this before. They're like, I know the drill, please just get me out of here. And yeah, so that was really cool. And I think that the nursery was a great experience, and also learning discharge planning and when to go to the NICU versus what's normal, return precautions for new babies, different things like that. And then I dive into the core part of this rotation, which was my inpatient part. Inpatient, I was at Bellevue for 1 week, and then I spent 2 weeks at Brooklyn. Bellevue, of course, is our huge public safety net hospital. We see anyone and everyone. We are so busy right now with a lot of the immigrants that are being moved from Texas to New York. We have a lot of hotel shelters in the city right now, so making sure that people are getting established with care, and then, you know, people are still having babies, and so taking care of those new babies. That was really, really cool. And then when I went to Brooklyn, it is more of a community hospital, and so I think the acuity of the patients is a lot less because it's an NYU hospital. So if someone, like, one of the things that I noticed is if there's a surgical emergency in a pediatric patient, we transfer them to our big hospital here in Manhattan. But lower acuity things are going to be at Brooklyn. Both hospitals also have different max patient populations. So at Bellevue, I want to say it was around 16 patients, versus at Brooklyn, the max is 7 or 9 patients, so it was a lot less. When I was at Bellevue, I would arrive at 7, run the list with the night team, then I would pre-round on my patients, then we would do rounds with social work, nurses, everybody. Then the attending would come, 9:30. We would round. That would usually take us until lunchtime around 12 because we were doing family-centered rounds. And then if we finished early, we'd do a little bit of teaching. And then the afternoons I had didactics, other things. But was getting off earlier than a lot of my other rotations. On the other hand, Brooklyn was really nice because I also had to be up at the same time because I took the 7 a.m. ferry. NYU owns a ferry that takes you in between Manhattan and Brooklyn. So I was on the 7 a.m. ferry, but then I didn't start until 8 a.m., run the list with the night team, similarly, pre-round on my patients, and then 9 or 10, depending on what we had going on in the morning, I would round with the team, and then it usually didn't take us that long, so 11:30 or 12:30, I would be back on the ferry home, which was really, really nice. How did I like the rotation? I would say that overall the rotation went good. When I started the rotation, I was exhausted because I was coming off a vacation. I was not looking forward to it, I'll be honest with you guys. I just wanted to be back in Cancun. But once I started, I did outpatient. I'm a clinic girly. We've known that, and it was just amazing. I did the private practice clinic, and I was really able to build relationships with that attending the day that I was there. And at one point I was thinking, am I going to be a pediatrician? I don't know, I can't even explain it, but I just really loved the fast-paced environment of the clinic and just doing a lot of more educational piece and preventative care. So that was really cool. And then I think that once I got to inpatient, the first week was okay, and then when I got to Brooklyn, I think just because there was less patients, there was lower acuity of patients and just not a lot to do, and the attending I was working with wasn't very passionate about teaching. So I was just like, okay, wake up, commute 2 hours for my day, and I'm there for maybe 2 hours. So it wasn't ideal, but still loved outpatient. I loved interacting with the kiddos. They just make you feel so young because they love the bubbles and the stickers. One of my Favs patients, they gave me a sticker when I was interviewing them during their patient history, and I was like, oh my god, they love me, and that was so fun, and I felt like I just won the Peds game. Yeah, I just think it was like, it wasn't my favorite rotation, but I also didn't hate it. It did what it needed to do, and yeah. Moving on to studying for the shelf. So I actually got my shelf exam back before I recorded this video tonight, so I'm gonna say my shelf exam score now. So if you don't want to see it, then you should like skip 10 or 20 seconds. But I got an 80 on the peach shelf, and the average is a 78, so I was above average, which is amazing. At my school, we do not put a lot of emphasis on the shelf exams. They're more of a way to keep us on track for studying for Step 2, but in terms of our grades, they're only 10% of the grade, so a lot less focused on the shelf exam. But I felt more confident with the shelf because I think that our didactic schedule was amazing, and they kept us on top of things because we also had weekly quizzes. But in terms of studying for the shelf, of course, I did the same thing that I normally do in terms of getting through all of my Anki cards. There was 609 Anki cards, and same deal, I do the Anking deck, then I go by tag, so shelf exams, and then pediatrics, no dupes, only Step 2, and it should be about 600 cards, 609, and I did all of those. Then I also got through all of the U-World questions. There was 583 U-World questions. With our schedule, we had quizzes on different topics weekly, so I tried to study by subject so that way I could prep for the quizzes, and then I would try to do also like more mixed blocks towards the end of the rotation. I only took one NBME practice exam because our clerkship directors told us that Our clerkship directors told us that the difficulty of the exam was more like UWorld, and a lot of people find the NBMEs to be easier. So I only did one, and it was the week before, I think I got a 74% on that, and so then I got 80% on my shelf, which was great. Also watched Dr. High Yield. I love his videos. I watched them the day before, and amazing person on Reddit also has made notes for all of his videos because I'm someone that I can't just sit and watch him because there's no visuals. So I love that someone was so amazing and made notes for them. I'll make sure that it is in the description below. I also watched the Emma Holiday videos. The Emma Holiday videos are amazing as well. I watched Emma Holiday a couple of days before the shelf exam, just as a kind of, I usually put it on my TV screen and then I close my eyes because the slides have the questions and the answers, but I like to close my eyes, and so then I can just listen to her and I can kind of quiz myself. And there are a couple of errors in the video because it is so old, but it's also still so helpful. And our clerkship directors for peds are amazing, and they made a list of all the errors, so I'll make sure to put those in the description below. And I also made this lovely like document. I call it my high yield shelf topics, but it's not really high yield, it's kind of just like stuff that I suck at. And so let me see if I can get it on the screen for you guys. So it is just this here. Essentially, it's just a bunch of compare contrast tables on things that were constantly popping up in UWorld that I just felt not as great with. So I did one for developmental disorders, I did immune deficiencies, infectious diseases, all of the different childhood exanthems, so all the rashes, congenital infections, toxicology, murmurs, what else? And lab abnormalities. But I will also make sure to add that to my free resources folder, so make sure to subscribe so you can get access to that. And I think it's just going to be such a helpful resource. I also have a lot of videos linked in there as well. Who is it that I like? I can't think of the name right now. Dirty Medicine. Dirty Medicine, those videos on YouTube are amazing for step studying, but they had just a couple of quick videos for immune deficiencies, childhood exanthems, different things like that. So I also watched those for the ped shelf, and they were very helpful. Now, the last thing that we're going to chat about are my tips for the peds rotation, and I need to go grab a prop for this, so give me a second. So, the number one thing that you should do before you start your peds rotation is get these amazing badge reels. They literally clip onto the back of your badge, and one side has all the vitals for the peds kiddos, and then the other side has all of the milestones for the peds kiddos, because the vitals are different. So let's look at this. For example, in a newborn, the heart rate can be up to 170. So you don't want to say that the kiddo is tachycardic when they're just a newborn. So I loved having this badge reel. I literally had it with me the whole rotation so I could just quickly look at it. And then also for outpatient or inpatient, you're trying to see if a kiddo is developing well or normal, then it just has all of the key milestones as well. Of course, these I would say the milestones more than the vitals, but the milestones are really important for the shelf exam. You're usually going to have one or two questions that are going to ask you, here's a vignette, here's like a 4-year-old kiddo, and they can like copy a circle, and they can hop on one foot, and they can do all of this, and they can speak this many words, and are they developing normally for language, social, gross motor, fine motor? So really important to know those. I'll make sure to link those down below, and also just make sure you become familiar with them on your rotation. You also want to know the vaccination schedule. This is going to help you on your rotation, because if you're seeing healthy kiddos for well visits, you need to know what vaccinations they're due for and when, but it also helps you for the shelf exam, because you need to know if a kiddo has not been vaccinated against H flu, then they might be more at risk for getting H flu epiglottitis, but you also need to know at what ages they get the vaccines. It's usually like a chunk of them are 2, 4, and 6 months, and then the live vaccines are 1 and 4 years old, so MMR and varicella at 1 and 4, and then most of the other ones are 2, 4, and 6, with the exception of like Hep B, you start at birth, you know, all that good jazz. You'll learn it. And then also like some of the differences, like kiddos with sickle cell disease, they get more pneumococcal vaccines because of their increased risk. So you'll learn all of that, but a couple things that you should definitely know. We talked about this for medicine and AMP care, but keep practicing your SOAP style notes. Make sure you chat with your attending or your residents and know if they want you to do the plan based on problem or system. I felt that systems-based worked a lot better in the kiddos, because sometimes they would have asthma, but they were having asthma exacerbation, but then maybe like a pneumonia on top of that. And so we were treating all of those together. So it's easier just to talk about respiratory, but just depends on what your hospital likes to do. Essentially, family-centered rounds is something that I've only seen on peds, which makes sense. And the way that we were taught is you have the entire team go in, you introduce yourself, you allow the rest of the team to introduce themselves, you'll have the nurse for the patient there as well, and essentially you just ask the patient and their family, whoever's in there, how the night's been, any interval events, and then you can see if they would prefer for you as the team to talk, get all the medical jargon out the way and present the plan, or if you should talk and include them. And then of course when you're doing that, when you're presenting, you would just use more layman's terms. Seeing some good and bad examples of that will be helpful. Just really know the details of infectious disease very well. So little things like peritonsillar abscess versus epiglottitis versus retropharyngeal abscess versus CRU versus bronchiolitis, all that good jazz. And then also all the childhood exanthems, so all the different rashes, and know when they present, how they present, if they're related to fever, all that good jazz, which ones present on the palms and soles, everything like that. And then also know your antibiotics for the different rashes, and also for things such as neonatal sepsis in less than 21 days or 28 days versus older, all that good stuff. You'll definitely learn it, but those are some key things. I think that infectious disease, when I was reviewing my NBME, and then also I feel like thinking about test day, infectious disease was a huge component of it, so just becoming comfortable with that will be helpful. And then of course, I love to share my favorite apps that I use for the rotation. Of course, I still love UpToDate. I think UpToDate is great for figuring out how to take care of patients, what the most updated recommendations are, and also figuring out the drug dosing, because you are going to do weight-based dosing in kids. And of course, residents and attendings should have to finalize the orders and they should check behind you, but it's also cool if you can look these things up and help a little bit. And then also PedsScript, that is a great app. I don't know if it costs or not because my school provided it for us, but it essentially it allows you to search based on chief complaint or diagnosis, and then it will give you the treatment options or the workup, different things like that. And then also MD Calc, that's going to be perfect for all of your rotations for little things like, okay, a kid comes in, I think they have strep, let me calculate their Centaur score to see what is the likelihood of strep pharyngitis versus another illness or pathogen causing their illness. So yeah, I think that's it. I'm terrified because I'm leaving like the happy, nice world of peds and diving into OB, but I'm excited because I feel like I've seen the kiddos and now I need to see where the kiddos come from and see them when they're super little. So very excited. Thank you guys so much for tuning in. Thank you for listening to me talk all about my peds rotation. I hope that it was helpful. I hope that these tips will help you prepare for your peds rotation, show out, and also crush your shelf exam. If you have any questions or anything that you want to see, make sure to drop that in the comments below. Until the next video, make sure to subscribe and I will see you next time.